A study have found that many COVID-19 survivors are likely to be at greater risk of developing mental illness. Marvy Delfin will give us the details live. Marvy?
Kath, nearly 1 in 5 people who have had COVID-19 are diagnosed with a psychiatric disorder such as anxiety, depression, or insomnia within 3 months of testing positive for the virus, according to an Oxford University-led study that suggests action is needed to mitigate the mental health toll of the pandemic. Paul Harrison, author of the study and professor of psychiatry at the United Kingdom's University of Oxford, said doctors and scientists around the world urgently need to investigate the causes and identify new treatments for mental illness after COVID-19. The study, published in the Lancet Psychiatry Journal, analyzed electronic health records of 69 million people in the United States, including more than 62,000 cases of COVID-19. The findings are likely to be the same for those afflicted by COVID-19 worldwide, the researchers said. Simon Wesley, an expert in emergency preparedness and response from King's College London, suggests these findings do fit with observations seen in previous pandemics. However, it is possible the viral infection may be somewhat causally connected to these mental health conditions. As he said, COVID-19 affects the central nervous system and so might directly increase subsequent disorders. But this research confirms that is not the whole story, and that this risk is increased by previous ill health. It was also found that people with a pre-existing mental health diagnosis were 65% more likely to be diagnosed with COVID-19 than those without. According to Dr. Max Tacky, one of the authors of the analysis, this findings was unexpected and needs investigation. In the meantime, having a psychiatric disorder should be added to the list of risk factors for COVID-19, while researchers also noted that there currently is no known physiological mechanism to causally connect COVID-19 with an increased risk of psychiatric disorders. But researchers from Oxford clearly stated the effects detected in the study are significant enough to demand urgent investigation, saying regardless of the cause, it seems clear COVID-19 will inevitably trigger higher rates of mental illness in the coming months and years, and healthcare services must be prepared. Professor Harrison emphasized services need to be ready to provide care, especially since our results are likely to be underestimates of the actual number of cases. We urgently need research to investigate the causes and identify new treatments. Kath?
Thank you, Marvy, reporting live from Australia.